Hi, I'm Dr. Jeanelle de Gruchy. I'm Director of Public Health in Tameside, and I want to give you an update on where we are with COVID in Tameside. The good news is that COVID is going down generally in the country, but unfortunately we're not seeing that similar reduction in rates in Tameside in quite the same way. Our rates are remaining really quite high and haven't been coming down for the last 2 weeks. In fact, what that means is that we are now ranking 11th highest as an authority in the country. So we are above the national average. Our rates for the last week remained above 180 per 100,000, which means over 400 cases that we know about of people who have the infection in Tameside over the last week. We know that the Kent variant of COVID is now the variant or the kind of COVID that we have in Tameside. It's over 99% of COVID. And what we know about the Kent variant is that it's so much more easier to catch it and to pass it on. We have done really well in vaccinating a large number of residents in Tameside. So our vaccination program has ensured that more than 65,000 residents have been vaccinated, and we're well ahead with vaccinating the next priority groups, so that's the over 65s and adults who are extremely clinically vulnerable to COVID. But while we still have this very high rate of community transmission of COVID, there are still a lot of residents in Tameside who haven't been vaccinated, and many who could still get really very ill and be hospitalized if they were to get the infection. So what we really need to do is not take our foot off the pedal. We have to keep going. What we don't want is for our rates to remain higher than other parts of the country, and that we get left behind with ongoing high transmission of COVID in our community and the potential, unfortunately, of continued local restrictions. So we do need to see that plans for relaxing restrictions is more in the future and more of what we need to look forward to rather than what we can do right now. Every action each of us takes can make a difference. So we all do need to continue to stay at home, stick to the rules, keep our social distance, wash our hands, wear a face covering, and make sure that our indoor areas are well ventilated. If you develop any symptoms of COVID, such as a fever, new continuous cough, or a loss or change of taste or smell, you can obtain a test by visiting nhs.uk/coronavirus or by calling 119. And remember, if your test is positive, you do need to follow the guidance, which does include self-isolating immediately for at least 10 days. If you need any support, such as food or financial support, please visit our website at www.tameside.gov.uk/coronavirus/self-isolation. Thanks everyone for listening and for all that you're doing to follow the rules and help keep everyone safe.